physician-owned. We've been completely independent for the last 60 years.
What makes ADC stand out maybe from other choices in town is, one, our history. We have been in Austin for a while, but while we've been here a while, we're also very innovative.
I came in 1977, and at that time there were like 20 or so physicians. And it was at that time more of a general, everybody, the subspecialties weren't developed as much as they are now, so everybody kind of saw everything initially, and then this has kind of evolved over those 37 years to like it is in almost other parts of the country, but they were ahead of that sort of notion at the time, so that has flowered and become a real important and good part of patient care.
One of the best things about ADC, I think, is the fact that we have a bunch of different doctors from different specialties under one roof, essentially.
Pretty much you name it, we got it, and we'll serve you well.
One of the greatest benefits of being a patient at ADC is how connected all our physicians are, that you can go to one organization and have your physicians talking to each other. That's not just through our electronic medical record where you're connected, so if you go from one physician to another, they have your medical history, but literally talking to each other because they work in the same environment.
This is a place where patients can come and get high quality care and compassionate care. I think that we care about our patients as much as we care for our patients.
What I love about ADC, it's a family. You get to know the other coworkers, and we all group together and support each other.
No one of us can get the whole job done, and none of us can do our jobs without the other folks helping to support one another. So that collegiality of it, I think, is really important, both among the physicians, but also between the other staff members.
What's nice about, from a physician standpoint, is that physicians can come here, they see their patients, and they can essentially go home. And I think it's they don't have the other pressures from outside physicians, such as having to balance the budget and having to pay their nurses and all that. What's nice about as a physician here is that it's very easy to come in, make good quality care, or give good quality care, and then be able to go home and have a good quality of life.
What sets us apart from the other clinics and the other doctors is our history and our future. And the history is where we got together with founding principles that included continuing education, hard work, and caring about our patients as much as we care for them. And our future is bringing in, on a continuing basis, excellent doctors with new knowledge and new skills so that we can continue to progress our treatment capabilities to give the highest quality care in the community.
I see the future of ADC as a clinic that puts the patient as the center of our attention. And we have developed our vision and our core values to be tailored towards the patient care. And as the healthcare reform is changing the way we do healthcare, we are adjusting our services to move from taking care of individual patient at a time to the patient population. We are moving from individual physicians to patient care to a team approach to a patient population care. And that involves identifying the needs of the patients and proactively reaching out to the patients and meeting the needs or filling the gaps of care for a patient population, with the ultimate aim of improving the quality of care, including the customer service, and lowering the total cost of care.
To me, the clinic has been on the forefront of trying to anticipate those changes and address remedies so that we can continue to do the best job possible for our patients, which is ultimately always everyone's goal.
One of the important things is that most of the doctors who come here want more than just a place to practice medicine. They want to be part of something big, something that they feel is going to contribute to the community, and that's the clinic. And so they want to buy into the clinic, if you will, be a part of the clinic. And in turn, the clinic becomes part of us, and that's very special.